Hi, my name is Megan Ramirez. I did my interview on respiratory therapy. I interviewed one of the instructors for the program. His name was Julio Garcia. I sat him down and I asked him a few questions about the field, and I wrote some notes down about his answers. The first question I asked was, how did you decide to go into this field? He said he wanted to become a physician, but he also wanted to get married at the time, and so he researched other fields and decided that respiratory therapy was a quicker alternative, so he became a respiratory therapist and fell in love with the field and stayed there for 30 years. The second question I asked was what education requirements are needed to get a job in this field. He said it had changed since he did it 30 years ago, but now it is an accredited respiratory therapy program, at least an associate's degree. The third question I asked was, what is a typical day like in your field? And he's worked several jobs in his field that are very different. Currently, he's an instructor, and he also works for an insurance company. And what he does is he goes and assesses patients, like kids and adults alike, with asthma or other similar chronic respiratory illnesses to see if there's and give recommendations of medications or treatments, options that they need. Of course, he also instructs, but he also, when he worked at a hospital, he would do rotations starting as early as 6:30 in the morning to talk to patients before and get treatment started before they got their breakfast in the morning. And so a lot of his time was, a lot of his his job included a lot of time management. Of course, what he emphasized was that there's no such thing as a normal day at a hospital because there's all sorts of different things that happen every day. The fourth question I asked was, what do you think are some current trends in your field? And he answered that there are different protocols now, like 10 years ago, you had to go to a doctor and ask what the treatment options were and see, it was kind of different for each patient, which it still is today. But now there's protocols, there's options that, you have to follow in each different case. There's also a different dynamic in the workplace. It's more team-oriented than like the hierarchy of the medical field. Like instead of the doctor being the end-all be-all, it's more geared towards the nurses and the respiratory therapists are really equal. Then there's the the physician's assistants or the nurse practitioners than the doctor. So there's a lot of different distribution of authority. Okay. The next question I asked was, what are some good things about your job? And of course he said, like most medical professionals would say, was working with patients, helping them get better, educating them on how to treat themselves, and also conducting interventions with patients that aren't helping themselves, and in getting them better as quickly and as efficiently as possible. The next question I asked was, objectively speaking, not geared towards me, but geared towards an audience, what advice would you give to someone going into this field? And he said that it's a good career. You get to work with people, you administer medications just like a nurse, and if you want if it's something that you want to do and if it's something you want to pursue, a good way to figure out if this is for you is to go shadow a respiratory therapist at a hospital. And there are plenty of resources at wherever you go that'll make that happen. The next question I asked was, how has this job changed over the years? And being that he's been a respiratory therapist for 30 plus years, it has changed quite drastically. Being that 30 years ago there was definitely different technologies used. The ventilators were about the size of this room, but now they're about small. There's more medication options for chronic illnesses and genetic illnesses like cystic fibrosis, for treatment options and, just to get patients better. And the last question that was really interesting, I think, was is there a specific class that he would have recommended for me to take that's not exactly on the course or like on the program? And as it would be, there is no ethics requirement. And the thing is ethics is so important in the medical field, it's almost surprising that there is no requirement for that sort of thing, because apathy in the medical field is the patient's worst enemy. And so I found this interview to be extremely educational, and I do intend on pursuing this career. Thank you.